Hey everyone, Michelle Frary here, Member of Parliament for Peterborough, Kawartha. And a very, very big announcement today in Peterborough coming out of CMHA HKPR, which is Haliburton, Kawartha, Pine Ridge. So we just wrapped up a press conference here. It's a very significant, very significant day. On November 30th, 2023, a national suicide hotline will launch, 988. Please remember this number. Please share this number. Hopefully we will have graphics that you can be posting all over your social media everywhere. 988. Right now in Canada, there is no national hotline that is this simple. There is a hotline. I bet you don't know the number. It's 1-800 blah, 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 blah. Nobody knows. Right now you have people who are showing up to our hospital, and our frontline workers are completely exhausted. They're completely burnt out. This hotline, this national hotline, is going to relieve our hospital. It's going to relieve healthcare. It's going to relieve backlogs. And most importantly, it is going to save lives. 12 people a day are dying by suicide. That's the number we know of. That's not the amount of people who may attempt it or are thinking about it. And that number is way too high. We have skyrocketing incidents of mental health crises in this country, young people. This is what I get called about every single day, every week in my office. So launching a national hotline for suicide awareness and intervention with people on the other line who know how to help you and no matter what will answer the phone 24 hours a day, this is life-changing in our country. And I have to give a huge shout out to my colleague, Todd Doherty, who fought tirelessly for this. So when I was first elected, the first person I met was Todd Doherty. And Todd Doherty's mission was mental health and addictions. Todd Doherty has a best friend who had a best friend who died by suicide. He has a brother who lives on the street with addictions. His passion and purpose is mental health and awareness. And he put forward this 988. And he pushed and he pushed and he pushed. And today we were announcing it. So I'm going to turn it over. I'm going to let you meet Mark Graham of CMHA HKPR, and I'll let you see. I'll get you to hold that right up so we can see 988. We need this so big. 988, 988. Mark, what does this mean to your organization? You were one of 45 selected in all of the country to launch this hotline. What does it mean for you?
It's really exciting for our organization to actually be a part of this initiative. I want to thank the federal government for their investment of $135 million on this new suicide helpline. I think for us, we were going through a restructure within our organization around four-county crisis. Four-county crisis is a service we've been offering for the last 18 years. It was very timely that we were approached through an RFP process to submit an application to the Center for Addiction and Mental Health to actually be the one of the proponents or a partner within 988. So we were successful in that grant. So we're in receipt of funding, which we will be providing 6 additional resources in our community. That sets the stage for how that aligns with our restructure with our four-county crisis program, whereby 988 will actually be the number that you will call to access services for individuals that might present with suicidal thoughts or suicidal ideation, and/or if they're in distress for crisis. We'll triage and assess the individual on that 988 number and then make a determination of a plan of action of either providing supports directly or we'll have direct links with 911. If it's serious enough. So for us, it's a great opportunity. I think it brings immediate response to an epidemic within our community. As you mentioned, Michelle, I mean, there's well over 4,500 suicides a year across Canada. Well, it's. I thought it was 15 a day. I thought it was 4,500, but I could be wrong.
Is it
4,500 suicides. About 4,500 suicides a year. 5,000 a year. Like it's usually you take a jumbo jet of 450 passengers, every month a plane crashes. So you take 45, 450 at 12 is roughly 5,000 suicides a year. So that in of itself, some of those lives could have been saved. And I know we invest a ton of money in COVID, and we ramped up services and supports for that pandemic, but we have a suicide challenge in our country. And I, again, commend the government in actually taking the first step, one, to investing $135 million to start, and I think it is a start. I think we're going to go beyond the 135. Once we identify and demonstrate the numbers, there'll be further investment around more direct supports and services to youth, our aged population, etc., along with our general population. So we're excited. Our team is ready. We're prepared to launch on November 30th at 3 a.m. A lot of work and time has gone into this and training, and we're ready for the call.
I think what I'm most happy about is so often it's the family and friends, the parents, the people who do not know how to navigate the system, the people who do not know what to say, who do not know what to do when their family member or loved one is in a mental health crisis. They feel helpless. And this number is not just for the person in crisis, it's for the people who love the person in crisis.
Yeah, I think the issue is stigma. It's still rampant. It's still out there. Nobody wants to talk about it. But the reality is, as you say, it happens every day. Somebody is having suicidal thoughts, or or people die by suicide. It's tragic. And you're right, Michelle, there are services that presently exist within our organization. We have a family support, 2 positions that are available to assist families who are dealing with or coping with a loved one that might have suicidal thoughts, or they're in crisis or in distress, that we're available to support the family. And then we have workers that are deployed at PRHC as well as Ross Memorial as Schedule 1 facilities in our community for mental health. Is if somebody is triaged and assessed and they return home, we follow the person back into the community. So those services presently exist, and again, they can be accessed through 988.
This is a step in the right direction. I asked Todd Doherty, who, like I said, my colleague who launched this and was the founding member behind 988 National Suicide Hotline, and I said, "Do you want me to quote you on anything today?" And he has very personal lived experience with suicide, losing his best friend to it. And he said, "Michelle, this is important, but we have so much more to do." And I agree with him 100%. So, but you have to start, and you have to recognize the problem, right? I love one of the great quotes I heard. The first step to change is admitting failure. And I think some people take that in a negative way, but it's not necessarily just failure. It's just we're not doing what we need to do, and this is helping. So, Mark, you guys do incredible work. I'm thrilled to see what's happening, and we're going to see the big things come out of Peterborough.
No, it's fantastic. And again, this is to cover the whole Haliburton, Kawartha, Pine Ridge region, the 705 catchment. And again, the program is there to help. So if you have any ambivalence or any concern or issue, I recommend call 988 and talk to someone.
Exactly.
Reach out, talk to someone.
Exactly. And I see your comment here, Lavender, about access to treatment, 100%. And that's what I say. Listen, we got to get there. We are not there. There is a huge gap still. And Mark knows that. I know that. But we're doing great work.
Yeah, I think 988 is the start. And then once it's triaged and assessed, it is to connect the person to the most appropriate service and resource to help the person, so they're not back at calling 988. And not to say that you're not going to get repeat callers, but I think what's important is we got to break the cycle. We've got to break get the services to the individual as timely as possible. Like, people should not be waiting for health care. And in particular, when someone's in crisis, it's immediate. They need a response
Instantly.
In very short order.
I will leave you with this. So we had this press conference today at the Chamber of Commerce. Thank you for hosting this for us. But after the press conference, someone came up to me who was here in attendance and in confidence said to me, Michelle, a lot of people don't know this, but my partner attempted suicide, and I wonder how 988 would have changed our lives if it had been available then. And so mental health, suicide doesn't care how much money you make, doesn't care what your religion is, it doesn't care where you live, it doesn't care. It impacts every single person. And you know, there's a great saying, you have 1,000 problems until you have a health problem. Then you only have one. And this is without a doubt the biggest issue because it's deeply connected to the people suffering in our country with affordability, the economics. People are very, very low right now. So I'm very optimistic that this will be a help, especially coming into the winter months. So thank you to your team, Mark. Really glad to be here today.
Thanks again, Michelle, for all of your support.
Thank you.